CTOs are very common. They're seen on 15 to 20% of coronary angiograms that have significant disease. CTOs are being attempted by other hospitals in Oregon, but in those other hospitals, they're doing the traditional approach, the antegrade guidewire escalation approach, which is not successful in the majority of cases. So what we've been doing differently is introducing some of these other newer techniques along with the traditional techniques, not just going in through the front door the way we do with other blockages, but so-called retrograde techniques where we go through the back door. And also techniques like dissection reentry, where we get under the skin of the artery and then go around the blockage and then get back into the artery on the other side of the blockage. And what we do now is combine those techniques in what's called the hybrid approach, the hybrid CTO approach. And using those techniques together, sometimes using several in the same procedure, it's raised the success rate tremendously at opening CTOs so that most centers that are doing this are now getting success rates of greater than 90%. Mr. Toplis's story goes back over 20 years ago when he lived in Colorado. He was experiencing angina and had a coronary angiogram performed there. And the recommendation was that he have bypass surgery.
Flew me to Denver and then flew me via helicopter from the airport to the hospital. And they did a quad bypass. The bypass worked very well as far as I was concerned. The way I felt was, I felt like 20 years earlier, you know, I felt quite good. Well, within 30 days, one of the bypasses totally blocked.
They did another coronary angiogram and found the graft was blocked. And so for the last 20 years, it's been attempted to treat him with medications.
So the next thing I knew, Dr. Cook called me.
And like out of the blue?
Out of the blue, you know, just one day he called me. And I'd never heard of Dr. Cook at all. And he said that they had developed a new procedure and he had discussed it with Dr. Sanger and determined that I was a good candidate for this new procedure.
We talked to him about the risks and benefits of the procedure, and he was very interested in going forward.
After, 20 years of having the angina, I was said, go for it. I'd be willing to do anything,
We were able to open his chronically occluded right coronary artery, even though it had been occluded for at least 20 years. In his case, we used a retrograde technique, what's called a reverse cart, which is controlled antegrade and retrograde tracking, where we go in through both the front door and the back door and establish a common channel and then stent through that channel. So we got a very nice result in his case, and he had very sudden, quick improvement in his symptoms. I went back to see him that evening. He was one of the first procedures that we had done that day. And when I saw him that evening, he had already been walking through the hallways, and he said it was the first time he'd been without angina in 20 years.
I got up and walked. No pain. And I'm sure I was grinning from ear to ear. And because I was so happy about it, it was a real revelation to not have that pain.
I have to say that in all the years that I've been practicing, this is one of the most gratifying things that I've ever done, in that the patients that we're treating have been experiencing angina for years, sometimes decades, And opening these arteries, they have a dramatic and immediate relief of their angina. And these are some of the most grateful patients that I've ever taken care of.
They did a good job. Everybody, thank you.
It's funny because the people who do this really believe in it, because there are so many stories like Mr. Toplis's. There's so many people in whom we've made such a dramatic difference in their quality of life. So that's the message that we're really trying to get out when we're talking to physicians in other parts of Oregon. This is something that's very common. There are a lot of these patients out there. There are a lot of patients with CTOs that aren't being well treated at this point. They continue to be very symptomatic. They're on a lot of medications, and we now have the technology, the procedures where we can make a dramatic improvement in these people's lives.